Hi, I'm Kiana. This is week 10 of pharmacology tutoring for Southwest College of Naturopathic Medicine, and we're going to be covering gastrointestinal drugs. To start, we're going to cover peptic ulcer drugs. So here's a picture of a peptic ulcer. They can either be in the duodenum or the stomach, and they have slightly different symptoms. I encourage you to review the symptoms of both. So an antacid that is commonly used to treat gastroesophageal reflux disease or heartburn, issues like that, would be calcium carbonate, also known as Tums. Very common. This can lead to constipation or hypercalcemia, which is too much calcium in the blood. Another useful drug in the treatment of a peptic ulcer could be an H2 receptor antagonist. These end in tidine or tidine. Ranitidine blocks the H2 receptors in parietal cells. Okay. Parietal cells will make hydrochloric acid. So by blocking this, less hydrochloric acid is going to be produced, and you're going to reduce the amount of peptic ulcers. Ranitidine can also cause headache, fatigue, myalgia. Myalgia is muscle pain, and prolonged or increased blood alcohol content. So you're not going to metabolize alcohol as quickly when using ranitidine. A proton pump inhibitor can also be used to treat a peptic ulcer. Omeprazole is the most popular proton pump inhibitor, and it blocks the hydrogen potassium ATPase that's in the parietal cells. And this will also produce less hydrochloric acid. So it's useful in gastritis, and especially gastritis related to H. pylori. Drugs for inflammatory bowel disease. So inflammatory bowel disease is two diseases, Crohn's or ulcerative colitis. Together, they make up the category of inflammatory bowel disease. Both drugs, sulfasalazine and adalimumab, not saying that again, we're calling it Adlim the rest of this video, I hate it. Both of them can treat not only ulcerative colitis and Crohn's, they can also treat rheumatoid arthritis. All three are autoimmune conditions, so it makes sense that both drugs, which have really hard to say names, will treat all three autoimmune conditions. Sulfasalazine will form salicylates, which are similar to what aspirin does, in the gut, and it will reduce cytokine production, and this will also reduce the immune response long term. They can cause a rash or low sperm count, also known as oligospermia, and low B9, but the low sperm count is reversible, so it's not forever. That's good, but still maybe be caution in prescribing. I'm not saying it again. Adalim, used for RA, Crohn's, and ulcerative colitis. So this is going to bind tumor necrosis factor alpha, and if it helps you remember that this drug starts with an A, and tumor necrosis factor alpha, they're related. Yes, so tumor necrosis factor alpha is very inflammatory, so it's going to bind that, and there's going to be less of it as a result, or less action. And it lowers inflammation and long-term autoimmune activation. All right, so that is the down and dirty on peptic ulcer drugs and drugs for inflammatory bowel diseases.